Namaste and welcome to the next episode of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing Pranosotus diseases and we have completed Hikka in the last lecture. Now we will move towards a very important disease as far as practice is concerned, and that is Rudro. Always remember, whenever there is Avayavachak Vikruti in the name of the disease becomes Kashtasadhya or Yapya. For example, Rudro, whether Hruday Avayav as such has got deformity, Udara, Grahani. So, in that sense, Rudro is a very difficult or Kashtasadhya Vyadhi, first thing. Secondly, it is Sadhya Pranahara Marma. It also makes this disease a very difficult or challenging for the treatment. Now, when we are describing or discussing Rudro, in Ayurveda there is Vataja, Pittaja, Kafaja, Rudro. We all know that types. But in modern science, they have totally different types of anomalies described as in under the heart diseases or Rudro. And nowadays we have to deal these anomalies or different abnormalities in the framework of principles of Ayurveda. So we will discuss these different anomalies separately, and I will try to describe them in the framework of the Nidhan Samprapti or principles of Ayurveda. As I said, Rudro itself is a difficult Vyadhi or challenging to treat, not just because of it is Avayavachak or Sadhya Pranamara Haramarama, but another factor in this is it is the Moola Sthana of two Srotasas, एक Pranava Srotas as well as Rasavaha Srotas. So, when a Hruday Rog is formed in the body of the patient, you have to deal with both these Srotasas according to the symptoms of the patient. We are going to discuss this in detail, how we will analyze the Pranasodas Vikruti and how we will analyze at Hruday as a Rasava Sodas Moolasthana is being deformed. So, when there is a patient of Rudro, always keep in mind you have to counsel the patient about its risk, about its Yapyata or Kashtasadhyatva, and you have to convince the patient about the time period which will take for the treatment. The most common abnormality, as we all know, which is seen in the practice, is the infarct. Let us discuss this abnormality one by one. We will take infarct first. Now, what is infarct? It is the stoppage of the blood supply to the particular area of the Hruday. And as there is stoppage of the blood supply, the part after the blockage doesn't receive oxygen in time, and that tissue becomes dead or necrosed. Now, patient comes to you with the report of angiography and indicating there is blockage somewhere. It is now our duty that how you will analyze this patient of infarct on the basis of Ayurvedic principles. Now, infarct, as I said, there is a stoppage of blood supply by any reasons, and the common reasons are there is clot in the some vessel or artery of the Hruday because of the blockage because of any clot or thrombus, or there is complete occlusion of the lumen of the blood vessels because of cholesterol or any air bubble. Now, You have a report of angiography, patient has come to you and he has shown that there is clot somewhere in the vessel. Now, how we will make this samprapti in Ayurvedic framework? In the case of Srotas Doshi Lakshana, the shlok is very important and you have to keep in mind treating each and every patient that Atipravruti Sangova Siranayam Granthyopiva Vimarga Gamanam Chapi Srotasam Doshi Lakshana. This shlok is very much important because all these symptoms you can see in every disease. Now patient in front of us is of infarct. What is the shlok saying? Atipravruti Sangova Siranayam Granthyopiva. Now this is the normal blood vessel, for example, and now there is some obstruction because of thrombus or cholesterol or air bubble. So blood coming from this one and this at this area, because of the blockage it is not passing forward and the heart is not getting the blood supply. And what is the shlok now? Atipravruti Sangova Siranam Granthyopiva, and this is the infarct where we can analyze as Siranam Granthyopiva or also as a Sang here, because there is accumulation in the blood vessel. So when a patient comes to you as infarct, you can analyze on the basis of Sotasam Doshi Lakshanam that it is Atipravruti Sangova Siranam Granthyopiva. And what will happen? Because of this obstruction, the blood flow will not go forward as well as it will go backward. Vimarga Gamanam Chapi. It will go in a backward direction. So now our framework on the basis of Ayurveda, patient has come with the report of infarct and you have analyzed it as Siranam Granthyopiva. Now we will discuss the treatment of this infarct in the next episode. Thank you very much.